welcome to the Integrative Health Convention 2018 online interviews. Today we're going to find out more about sports medicine and Dr. Patrick Reynolds, who's speaking at the convention this October. The Integrative Health Convention is an annual convention in London featuring many leaders in their fields of complementary and conventional medical therapies to help people get better through these various healing practices. It's an opportunity for doctors, therapists, and the public to meet, share, learn from, and connect with each other. We believe that true health is holistic and that people get better in more than just one way. We believe that we have all so much to learn from each other and that the Integrative Health Convention provides a stage for this for therapists, doctors, and the public. There are a limited number of tickets available which can be purchased at integrativehealthconvention.co.uk. This series of online interviews will help you get to know our speakers who are leaders in their different fields of healing or therapy, or and maybe help you decide which talk to attend out of the 36 talks to choose from over 2 days at the Integrative Health Convention 2018. I am your host, Dr. To Wong, and I've been a GP for the last 12 years in Devon. I'm co-founder of Neurolinguistic Healthcare Limited, the organizers of the Integrative Health Convention. Neurolinguistic Healthcare provides courses in advanced communication skills and therapeutic techniques, as well as training in hypnosis for healthcare providers. Today, I'm speaking to one of our excellent speakers who's coming to the 2018 Integrative Health Convention at the Park Plaza, London, 13th and 14th this year, 2018, to share with you what he knows and to tell us a bit more about who he is, what he does, and what to expect from his talk at the convention. So this is Dr. Patrick Reynolds, who's a specialist registrar in orthopedic surgery. He used to be a personal trainer, and he's going to come and talk to us about the perils of the weekend warrior. So, Patty, should we find out a bit more about yourself? And if you want to tell the audience a little bit more about yourself, maybe what I didn't cover.
Yeah, sure. Well, firstly, thank you very much for the opportunity to come and talk both tonight and at the conference in London. It's a very, very good opportunity, so thank you for that. I suppose really I've had quite a long route into medicine and surgery, having started as a personal trainer in that. That side of my work got me interested in thinking about how we load the human body and how the human body responds to load and responds to load in both health, from the point of view of strength and conditioning, and also how the body responds to load in disease and in injury states. And most of our thinking now in terms of managing soft tissue injuries is come around to the idea that it's not enough just to rest and ice and elevate as we used to. We now need to actually load the body under appropriate conditions, and that can lead to healing and actually deal with many of the soft tissue problems that we see today. I think my interest, I guess, has always probably stemmed from the fact that I've always looked after people who are healthy and fit, and taking on board their attitudes, their hunger and desire to get better and to perform better, trying to use some of those principles in my current work, where I'm dealing with people who are injured, who've been through trauma, have got chronic pain conditions, chronic inflammatory conditions, and trying to apply both.
So going from performance enhancement to healing and encouraging healing, I suppose. Very good. So I'm curious. You've tried to explain what sort of got you into doing what you do now, and the talk that you're going to tell us about. What's the story? Is there more of a story behind all that?
I worked as a personal trainer for a number of years. I got quite interested in looking at how people recovered from injury, and who got better, who didn't. Those that were doing their exercise and training and things tended to get better faster than those who just did nothing and didn't appropriately load the body. And I guess that line of work probably led me towards thinking about a career in medicine, with a view to either going into orthopedics or into sports medicine. And I guess once I started in medical school, the interest just spiraled, and I realized that actually in medicine we're continually hung up on pathological state, the treating patients according to a very specific algorithm. Do they have medical treatment? Do they have surgery? We sometimes can be accused of maybe fobbing patients off and just sending them off to the physiotherapist without making a real effort at making a diagnosis. And I think I realized that a lot of the tools I had from working as a personal trainer in terms of being able to assess how somebody moved, to see were their movement patterns contributing to their pain or their injuries, and if we can correct those, again using the skills that I'd learned through personal training, could we actually treat symptoms and treat some of those very problematic conditions that are very real to patients, but that I think in my field sometimes get maybe fobbed off a little bit as just something that is self-limiting or will get better over time. But in reality, patients want a diagnosis and they want a plan. And as well, I think using the techniques and all the various things I learned from being a personal trainer, you can actually give somebody something they can take to go away and do themselves, and it gives them ownership of their condition, and gives them something they can be quite proactive about.
Great, thanks, Paddy. For the audience, I don't think not everyone understands what people do in orthopedics. Can you just let the audience know a little bit more about what orthopedic surgery is all about?
Sure. So we're predominantly concerned with two areas really. One is trauma, so that really covers anything from someone who's had things, been in a car crash, to falling over, breaking their hip, to doing their surgery to get them back on their feet, get them back to their level of mobility they had before. We're also concerned on the elective side of things with managing people's pain, in particular pain that we think is arising from a disease of the musculoskeletal system, arthritis being a good example of that. And we have good, treatment options for patients with arthritis. Some will do well with pain relief, activity modification. Some will progress to needing, big surgeries such as joint replacement. But there's other conditions that we manage as well. And we see lots of patients referred to us with chronic pain conditions, which have failed to settle over time. Probably one of the most common is a trochanteric bursitis or lateral hip pain. This, sometimes gets misdiagnosed.
Talk about
so we'll rotate back to
perils of
there
the weekend
afterwards.
warrior. So in October at Park Plaza,
very good.
can you tell us a little bit more about what
Yes.
this is and what the audience will gain out of it coming to hear you talk?
Sure. So I guess I wanted to talk about a topic that I was able to draw on, my experience, and actually give really good examples of the underlying principles from strength and conditioning that I think can be applied to the sort of chronic pain type patient in that. I think a group of individuals that's quite worth looking at, and that's quite interesting to talk about, is the sort of recreational athletes, or the weekend warriors they're sometimes called. This is quite an important group of individuals, and I think keeping people active, keeping people in exercise is potentially the savior of the NHS. And I think there may be other speakers or people who've spoken about in the past the role of physical exercise in health. And there's a large number of studies and papers and videos available talking about the huge power that sort of physical activity has on improving health. Things from reducing risks of complications from chemotherapy, delaying onset of dementia, cardiovascular health, bone strength, all of these things, falls risk in the elderly. So it's really, really important that anybody who's involved in exercise is given the opportunity to stay within that. They're much less likely also to be a drain on the resources of the NHS by staying out of the healthcare system. But I think, unfortunately, being very active does carry its risks, and you will find that patients presenting in general practice or being referred to us in secondary care with these chronic pain conditions that can develop as a result of their activity. Examples of lateral hip pain, lateral knee pain, really, detrimental to the recreational athlete in terms of continuing on with the very thing that gives them, physical fulfillment, health, and well-being. And I sometimes think we can be guilty of doing them a disservice, and that we view this particular group of individuals as quite high performing and not necessarily worthy of the same level of input as somebody else who's maybe a little bit more frail. But in reality, it's a patient with a chronic pain problem who wants it to go away, who wants a diagnosis, who wants a management plan, and who ultimately, if they're allowed to stay in their sport or their physical activity, will stay clear of the health service and not need to be very reliant on pain relief and reliant on coming to see their GP, reliant on being referred to hospital, and will stay away from that doctor-patient paradigm. Some of the other things I'll talk about will be how to get patient groups like this, who are often quite proactive, to take ownership of their conditions and to take responsibility for their musculoskeletal health, and the importance of getting people to buy into what you're offering, and to gain an understanding of the particular conditions. I think patients are becoming very technological savvy, and many patients are coming to us self-diagnosing and telling us, I think I have condition X or condition Y, and expecting us to treat them accordingly or come up with an alternative diagnosis. There's a huge level of information available there, and I think patients do want a diagnosis, even if it's for a supposedly self-limiting condition. I think patients want us to take that seriously and give them a plan. Some of the techniques I'll talk about will be some movement screening, sort of simple movement screening algorithms that I follow and that I followed when I worked as a personal trainer, and that you can apply those to try and identify weak areas in the body. Somebody
so some help with
developing
helping people diagnose these conditions,
or just
and maybe
simply
some
pain
easy
because they're moving badly.
practical
And I'll help to
exercises
demonstrate some of these as well at the convention.
that they might be able to apply.
Yeah, I think so. I'll probably talk initially just about the sorts of problems that we can deal with. I think it's important to talk about the sorts of problems that we very much can't. I think it's important to be very clear on what, when pathology is present, that is sent down to the correct route, that if we need to be very clear about making sure that we're only talking about conditions relating to poor movement patterns and sort of chronic soft tissue type diagnoses. I think as well it's important to talk a little bit about communication skills and how we have a consultation with somebody when we're trying to get them to go away and engage in something physical in order to try and get better. I think that the patient paradigm can often be quite a passive one, and we're sort of trying to turn that on its head.
So having thought about the Integrative Health Convention,
so we'll talk
where the audience
in some way about that,
will be made up
and then,
of
as you said, hopefully have
doctors,
some
therapists,
demonstration as
and
to
the
how
public.
you can movement screen.
Having thought about
problems.
the health convention, where the audience will be made up of doctors, therapists, and the public, where do you see this approach fitting in with integrative health?
So I think I see it probably in all three, really. I guess for the general practitioner, I think a huge volume of work is in patients presenting with chronic musculoskeletal problems. And I think hopefully I'll be able to maybe give some tools that general practitioners could use. They could maybe draw on experience. And I think that's a really important thing to say, is that my knowledge and my background has all come from, I've learned from fellow trainers, I've learned from physios, I've learned about bracing and similar things from occupational therapists. I've learned from strength and conditioning coaches, I've learned from doctors, I've learned from surgeons. We need to get really clear about how important it is to draw on the multidisciplinary team. And And again, I think we can be a little bit guilty of not doing that in medicine and surgery. Whether that's a slight arrogance on our part, I don't know, but I think the multidisciplinary team, particularly in sports and exercise, has got a huge part to play, and we really need to try to learn from each other better. I think I've got a lot to potentially can offer therapists something in that. I can give them the take on what typically presents to orthopedics, what we see coming through from the therapy side of things, what we see coming through from general practice, types of patients in whom we'd really like to avoid surgery because it's not the right thing.
Okay, I'm asking one particular extra question. So as a doctor, as a personal trainer with years of experience, what do you think in particular is the key to healing and getting better in what you do? So I'm looking for something personal as to what you think.
Sorry, To, can you say that
what
again?
you do
That's
that
all
makes the most
echoing a
difference.
lot. I think it's acquiring the tools to be very clear about making the right diagnosis in terms of musculoskeletal pain. I think my profession's very guilty of just saying to a patient, this is not a surgical problem, you need physiotherapy. I think we do patients a disservice by that. I think what my years of experience have taught me is that by having some knowledge, you can make a really clear diagnosis about a movement problem that a patient has that's causing them pain. By understanding the nature of the problem, you can then give them a very clear plan as to how to address that. Giving people
Great.
exercise as a
I think
plan
that'd
is
be really
also
useful.
benign. It's not going
Sounds
to harm
amazing.
them once done in the
I'd love to
appropriate
attend this
way.
talk, but
They
then there are so
only
many to
can
choose
benefit
from.
from it.
36
The
different
worst
talks
that can
over
happen
2
is it
days.
fails to
And
relieve
I hope that
symptoms.
this
That
video
contrasts
and
massively
this
with surgery,
interview has helped
which
the
is the current
audience
field I work in.
choose which
Keeping
talk.
patients away from surgery.
So
Surgeons
remember to
saying
get your
this
tickets
is
early.
sometimes no bad thing.
Thank you to the audience
Um,
for taking your time
that's
to
it.
listen to this. We are the Integrative Health Convention in London on the 13th and 14th of October 2018. You can use the discount code podcast10, which I'll put below, which will give you a 10% discount as a gift from us to you for sharing your time with us. When we see you in October in London, you get to speak to Dr. Reynolds, myself, and all the other amazing speakers. And, we think it's going to be amazing. It'd be lovely to see you there.